My name is Michel Kahaleh. I am the Chief of Endoscopy at Weill Cornell, and I'm here today to talk to you about the recent paper published in GIE, Needle-Based Confocal Endomicroscopy for Pancreatic Cysts, the current agreement in interpretation. Needle-based confocal endomicroscopy for pancreatic cysts, it's something that we've been doing more and more often for any cystic neoplasia that need to be investigated to decide eventually if the patient might need surgery or not. So we try to do it looking at the confocal imaging associated with the interpretation of needle-based confocal endomicroscopy. We took 15 de-identified NCLE videos and we sent them to 6 interventional endoscopists at 5 institutions. We asked them to assess 6 variables: the presence or the absence of vessel, the presence or the absence of villi, the presence or the absence of dark clumps, the presence or the absence of reticular pattern, and the presence or the absence of acinar cell pattern and debris. We then asked them to categorize their final interpretation in mucinous, serous, pseudocyst, malignant, and indeterminate lesion, and come up with a final diagnosis of either a benign, malignant, or indeterminate lesion. The results show an inter-observer agreement that ranged from poor to fair. The mean accuracy of the observer was 46%, with the lowest being 20% and the highest being 67%. And we conclude that the inter-observer agreement and accuracy for PCLE diagnosis were actually low. Hence, the result of this study support the need to identify and validate imaging criteria to determine whether NCLE has diagnostic value for pancreatic pathology. If we have adopted NCLE in our current practice, it's important to figure out a way, a formula that will allow any interpreter to have the same criteria so they can increase their accuracy between one another. Thank you.